Welcome to the Aced It podcast, where we turn science into sense. This is the 14th season of Aced It, and we are so incredibly grateful that we are able to deliver rich scientific content to you in a usable and understandable way. Aced It is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to Aced It, welcome. We're so glad you're here. And check out the prior seasons to begin or continue your learning journey. A special thank you to every wonderful listener. We promise we will continue working to help you learn and grow via Aced It. Also, a quick plug for a few other JCOIN features. Did you know you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for a small research grant to help fund an innovative study idea? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator, a year-long mentorship that will improve your skills? Also through, you got it, JCOIN. If any or all of these exciting offerings sound interesting, check out our website, jcoinctc.org, and learn about the many JCOIN courses, products, and opportunities beyond Aced It, all designed to translate science into sense for you. With that, I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Welcome to episode 3 of season 14 of the Aced It podcast, about the stories we tell about drugs and overdose. This season, we're exploring the narratives told about drugs and overdose, who gets to tell them, and the narratives they choose to spread. Ultimately, these narratives shape stigma, guide policy responses, and affect access to treatment. Today, we're going to talk about social media framing. Platforms like Reddit, Twitter or X, TikTok, Instagram, and Facebook have all become central spaces where people talk about drugs, recovery, treatment, and overdose. These conversations can be supportive, educational, and community building, but they can also spread stigma, misinformation, and harmful narratives. And the research on this subject suggests something important. The way drugs and overdose are framed on social media can influence how people understand addiction, whether to seek treatment, and how policymakers respond to the overdose crisis. So, today we're going to look at what researchers are learning about how drugs and overdose are talked about online, and why those stories matter. Let's get into it. Across many studies, one thing becomes pretty clear very quickly. Social media is often a place where people talk openly about their struggles with substance use. In online communities like Reddit, for example, Chen and colleagues, 2022, found that many posts describes feelings of shame, guilt, or disappointment related to substance use. People reflect on past behavior, worry about how their substance use has affected relationships, and talk about wanting to change their lives. So a lot of the conversation online is shaped by internalized stigma, people blaming themselves or feeling ashamed about their drug use. Another theme that shows up often is fear of being judged. Many Reddit users talk about hiding their substance use because they worry about losing their job, disappointing family members, or being labeled as an addict. Even when someone hasn't actually experienced discrimination, the expectation that stigma might happen still shapes how they behave. At the same time, these online communities can also be places where people support each other. People share advice about recovery, talk about withdrawal experiences, and celebrate milestones like, quote, 30 days sober or, quote, 6 months clean, unquote. So in some ways, social media becomes a place where people find support and connection around recovery. But alongside those supportive conversations, there's also a lot of stigma and misinformation online, especially when it comes to addiction treatment. Durkar Sereddy and colleagues, 2021, analyzed thousands of tweets about medications used to treat opioid use disorder, like methadone and buprenorphine, and found that negative attitudes toward these medications were very common. Many tweets questioned whether medication-assisted treatment is legitimate recovery. Some suggested that people should quit drugs through willpower alone rather than using a medication. Others framed addiction itself as a moral failing rather than a medical condition. These narratives matter because they can influence whether people feel comfortable seeking treatment. And large-scale research examining millions of social media posts has found similar patterns. El-Sharif and colleagues 2024 found that across platforms like Twitter or X, YouTube, and Reddit, there are widespread myths about addiction treatment, including claims that addiction is simply a personal choice or that medications like methadone or buprenorphine are worse than the drugs they treat. Some posts also promote unproven alternatives as quote-unquote cures for addiction, even though these treatments lack strong scientific evidence. Because social media platforms tend to amplify content that gets strong reactions, misinformation can spread quickly and shape how people think about addiction and treatment. Okay, so we should probably also talk about how social media can shape how drug use itself is portrayed. For example, Sharian and colleagues 2018 analyzed Instagram posts related to codeine misuse and found that many images depicted codeine mixed with soda, often called quote-unquote lean, and frequently paired with alcohol, cannabis, or references to popular cultural music. When these kinds of images show up repeatedly online, they can make certain forms of drug use seem more normal or appealing, particularly to young audiences who encounter them often on social media. I should also probably mention that social media plays a big role in shaping how people think about the overdose crisis itself. In a study examining highly shared posts about fentanyl on Facebook and Instagram, Krasovich and colleagues 2026 found that many of the most widely shared posts framed the crisis through a criminal legal lens. Many posts focus on drug seizures, arrests, or law enforcement activity. In these narratives, blame was often directed at drug dealers or traffickers. Meanwhile, factors that research has shown played a major role in the opioid crisis, like pharmaceutical companies or healthcare systems, were rarely mentioned. And something else stood out. Public health responses were largely missing. Mentions of naloxone appeared in fewer than 9% of the posts, and medications used to treat opioid use disorder appeared in only a fraction of highly engaged posts. So even though effective tools exist to prevent overdose, they often receive much less attention in social media conversations than stories about crime or punishment. But at the same time, social media can also be a place where people try to challenge these narratives. Some harm reduction advocates have started using platforms like TikTok to share information about naloxone, explain how overdoses happen, and correct misinformation about drugs. Schlossler and colleagues 2024 found that TikTok features like hashtags, duets, and algorithm-driven feeds can help harm reduction messages reach new audiences. Many creators use these tools to respond directly to misinformation they see online, sharing research findings or demonstrating how naloxone works. For some people, these platforms also create a sense of community, especially in places where harm reduction is stigmatized offline. But speaking out online also comes with challenges. In interviews, harm reduction creators shared that they often receive hostile comments or harassment, and some worry that social media platforms limit the visibility of posts that talk openly about drugs or overdose. Also, researchers are starting to explore another interesting possibility. Social media might even help identify emerging drug threats earlier. One study conducted by Wright and colleagues 2021 analyzed more than 64 million Reddit posts and found that changes in how people talked about fentanyl online appeared more than a year before traditional public health surveillance systems identified fentanyl as a major driver of overdose deaths. By analyzing patterns in language, specifically how often drug names appeared alongside words related to overdose, researchers were able to detect changes in the drug landscape earlier than traditional surveillance systems. This suggests that social media conversations could someday help public health officials identify emerging drug threats faster. So, up to this point, we've talked a lot about how social media can spread stigma, misinformation, and certain narratives about drugs and overdose, but the research also suggests something important. Social media isn't just part of the problem. It can also be part of the solution. Public health researchers and clinicians are increasingly asking how these platforms can be used more intentionally to share accurate information about substance use and connect people with resources. One study by Dabla and colleagues, 2024, looked specifically at health promotion on social media and argued that social media is actually a powerful but misunderstood tool for harm reduction communication, especially when it comes to reaching younger audiences. Young adults are among the most active social media users, and many of them turn to the internet as a primary source of health information. That means platforms like Instagram, TikTok, Twitter/X can be places where accurate evidence-based information can reach people who might not encounter it through traditional healthcare systems. But simply posting information online is not enough. The researchers outline a few key strategies for how public health professionals can use social media more effectively. First, organizations need to maintain a consistent presence across the platforms where young people actually spend time. That means establishing recognizable accounts across multiple platforms and using clear, consistent branding so that users can quickly identify credible sources of information. Second, successful health communication online depends on building trust, not just sharing facts. Social media works differently from traditional public health messaging. People are more likely to engage with accounts that feel more approachable, authentic, and responsive, rather than accounts that simply broadcast information. And third, the format of information matters. Young audiences often consume information through visual and interactive content, things like short videos, graphics, infographics, and interactive posts. So, effective health communication on social media needs to match the way people already engage with content on those platforms. In other words, the goal is not just to translate traditional health messages onto social media. It's to adapt communication to the ways these platforms actually work. When used strategically, social media can help public health professionals share evidence-based information about substance use, promote treatment options, and connect people with life-saving resources. So, while social media can spread stigma and misinformation, it can also create opportunities to challenge harmful narratives, to support people in recovery, and to make harm reduction information more accessible. Okay, so what does all this mean? Well, social media has become one of the main places where people learn about drugs, talk about addiction, and share stories about overdose. Those stories can reinforce stigma or challenge it. They can spread misinformation or share life-saving information. They can frame addiction as a personal failure or as a public health issue. And because social media reaches so many people so quickly, the narrative or narratives that spread online can shape how society responds to substance use, which means that when we talk about the overdose crisis, we're not just talking about drugs. We're also talking, pretty often, about the stories we tell about them. Thank you so much for listening to the ASTIT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriter team and also my fabulous doctoral students at Sam Houston State University, Bryce Kushmerik-McCune, Jalen Magana, and Alexa Mata. And a huge and a heartfelt thank you to the team at Slonky LLC for their wonderful podcast production as always. Tune in again soon for another episode of ASTIT.